What is monovision? Well, monovision is a very useful technique in reducing people's dependence on glasses following cataract surgery. And what we do is set one eye predominantly for distance vision, and it's usually the dominant eye or preferred eye, and the non-dominant eye is set for reading or close vision. So for example, one would expect you to be able to look at your phone, see what you're eating or cooking in that eye. It reduces your overall dependence on glasses, but you might need to put them on for example, reading small print, or if you're doing fine distant visual tasks, if you're going to the cinema or if you're driving a car. It's not for everyone, and what we do prior to surgery is ask people to do a trial with contact lenses just for a couple of days. And in that you put a contact lens in the dominant eye, setting it for distance, and the non-dominant eye, setting it for close vision, and ask the patient to carry out their normal visual tasks. If it works well, then you would repeat the same arrangement when you do the cataract surgery. It has the advantage compared to setting both eyes for distance that you're less dependent on glasses. It has the advantages of over multifocal or bifocal intraocular lenses, and that you don't get some of the side effects of the lenses, for example rings around lights or what people sometimes describe as waxy vision in low light settings. And so you avoid all those problems with monovision. So it's effectively using a single focus lens, but one eye set for distance and one eye set for close to.